Hi guys, welcome to a new episode on mental health. Today we're going to be looking at mood disorders. And to start with, I'll introduce myself. My name is Ching'ambu. I'm a 7th year medical student at the University of Zambia Ridgeway campus. Now today we're going to talk about some of the causes of depression and how one would tell if they have depression.
I'm in love with the cocoa. I got it for the low.
So to start with, I'd like to make mention that depression isn't a weakness, as people put it, but it is an illness or a condition just like any other condition, such as diabetes or hypertension. Most likely the most common that people have heard about. And the world also is estimated that half the population at some point in their lifetime suffer from depression. And Zambia is also facing rising rates of an increase in depression, as we can see from our clinical side, as we interact with different patients who have these conditions. Depression is one of the most common that we encounter on the wards, as well as at Ching'ambu Hospital. And it will be important for us to learn a few things about depression, not too much into detail, but just enough to get you on to look out for your brother, your loved ones, or your sisters. And this is what this segment is all about. Now, to start with, we're going to look at what are some of the causes of depression. It has been established that the cause is definitely multifactorial, meaning that there are a lot of factors that come and play together in order for one to actually suffer from depression. Now, one of the first things that we're going to talk about is genetics. Now, genetics plays a very important role in developing depression, or in one developing depression. Now, some studies were done in which it was established that if you have identical twins, one of the identical twin has a 50% chance of developing depression if the other one has already underlying depression. It has also been studied that if you have a first degree relative, let's say your brother or your sister or your loved one has got depression, you are at a 3-time likelihood of developing depression as compared to someone in the general population out there. And the other factor that we're going to look at that has been attributed to cause depression are what are called stressors. Stress and interpersonal losses play a very huge role in the development of depression. It has been shown that different stressors that we're exposed to have a higher likelihood of us developing depression, depending on different factors also on how we handle stress, as well as the amount of stress. The perception that we have on how we respond to stress has also been shown to play a role in the development of depression. For interpersonal losses, for example, a child who loses their parent at the age less than 10 years have got a higher likelihood of developing depression later on in life. This is according to research that has been done, and this is what's currently on the ground. And the other factor that we're going to look at are the psychosocial stressors. Now, psychosocial stressors can be either things like bereavement, lack of care, neglect, all these things. These are things that have been shown to cause depression, or to increase the likelihood of one to develop depression in their lifetime. The other theories that have been established are the parent-child relationships. Now, what the parent-child relationship basically talks about is that the nature of the relationship between the parent and the child has been shown to have a direct role or a correlation to the development of depression. For example, if a parent and a child have a poor relationship, okay, let's say for instance there's a lot of child abuse going on and child neglect, so therefore the child is the one who tends to suffer all these stresses, and research has shown that later on a child who's exposed to such stresses has a higher likelihood of developing depression. A child whose parent has got depression has a higher likelihood of also developing depression later on in life. Now, this was according to a study that was done, which was called Sequence Treatment: Alternatives to Relieve Depression Child Study. It showed that children whose mothers had suffered from depression and later on recovered, those children had a better outcome in the next year in terms of both their behavior and their social functioning. They had improved dramatically. This showed the impact of parent and child relationship with respect to depression itself. So it is important for us to have healthy relationship with our children as a parent in order, to prevent some of these things. Pay attention to your child as they grow up, and give them the full support that they need, both mentally and physically. It's just not physical needs that they need, but both mental and physical needs alike. The next study that was done was to deal with how medical conditions are related to one developing depression. For example, there's what they call the neurodegenerative disease theory. So studies have shown that patients who have neurodegenerative diseases such as Alzheimer's disease and Parkinson's disease, they later on develop depression in life, and vice versa was true, that people who had suffered from depression had a higher likelihood of developing these Alzheimer's and Parkinson's disease. Other conditions that have been related to develop depression is also chronic pain, cancer, multiple sclerosis, macular degeneration, to mention but a few. These diseases have been associated with the likelihood of one to develop depression. Now, the theory behind this is that many people who are old, or many people with these diseases, they are under significant distress because of the condition that they have, such that it acts as a stressor and tips one into having this mood disorder called depression. There's also what is called the stress vulnerability theory. This one states that many people have different thresholds of dealing with stress. Some people have low thresholds, some have moderate, some have high. Those with low thresholds of dealing with stressors have a higher likelihood of developing depression. Those who have a higher threshold tend to have a less likelihood to develop depression because they can handle more stress than those with low. So it means that we cannot compare each other, we cannot point fingers, we cannot. Depression is not about willpower, and because of all these multifactorial factors, anyone can develop depression. It does not stigmatize whether poor, rich, educated, not educated. Anyone can develop depression. Like I said before, it's not a weakness, it is a condition that can be treated just like any other condition. Now, the cause of depression, when we come to the biological aspects of how the human being functions. Now, it is a disease of the brain or of the central nervous system. Now, what happens in depression is that we have what is called serotonin. Serotonin is a neurotransmitter. It's like a chemical that travels through your nerves and helps in those nerves communicating between each other and reaching your brain. So in depression, what happens is that the amount or the levels of serotonin go down because of all these interactions with these stressors and the risk factors that we've looked at. Now, serotonin is a happy hormone. It works in conjunction with dopamine, norepinephrine, to mention but a few. So once your serotonin goes down, your mood becomes low. Once your serotonin goes up, your mood you become a happy person. So that's more or less like the biochemistry of depression. Now, the next segment, we'll talk about how would one tell if they have depression. Thanks for watching this segment on depression. Hope you learned something. Comment, like, and subscribe in order not to miss out on the latest videos and notification. If you have any questions, you can leave them down in the comment section, and we'll do a segment specifically for responding to your comments. Thank you. See you next time.
I'm in love with the cocoa.